welcome to the Art of Being Human. When I first started this section on drug abuse, I went through the drugs that you can get in the big box stores, anything like acetaminophen and aspirin and things like that. And you can take too much of it and you can get yourself in real trouble, even though it's not considered to be an addictive drug, and even though you don't have to have a prescription to get it. But I want to go through that again because most people are on something. There are very few people in life that aren't taking something. They're taking it for pain or they're taking it for some other reason. And I found out there are people now that are taking chemotherapy for arthritis, but it's a different kind of chemotherapy than what a cancer patient would have. But nonetheless, it is a form of chemotherapy and it helps with their rheumatoid arthritis symptoms. And so I think that most of us, if we're in pain, we head for the acetaminophen, we head for the Tylenol, or we head for the aspirin. And so we can get damaged by too much. You have to be careful of your dosages. And I remember going through this when I first started this whole section on drug abuse, but I want to go through it again, because this is what most people are actually taking. They're taking these medications. And so you have to be careful of the dosages. And I've told this story before, but I'll tell it again. There was a lady who had the flu. She did not go to the doctor for help. She had the symptoms of the flu and she felt terrible. And she said, well, you know, if I take aspirin or if I take a drug, it'll help me with my symptoms. So she took something, and I'm thinking it might have been Tylenol, but I'm not 100% certain of that. But it was some kind of a painkiller that you can get in a store without a prescription. It wasn't anything unusual, but she took too much. Now, how much is too much? Well, if a bottle says 2 every 6 hours, don't take 3 every 6 hours, because eventually you're going to overdose on it. And I don't know how much more she took than what she was supposed to, but the flu eventually left, but her illnesses were just kicking in, and she was feeling very, very sick. And as it turned out, whatever it was, she went into complete liver failure. Or it was either liver failure or kidney failure. I can't remember exactly what the drug was that she took, but it was something that she got from a store. It turns out, in order to save her life, they had to do a transplant. So now she has to take anti-rejection pills for the rest of her life because they had to do a transplant. That was the only way to save her life, was to do a transplant, all because she took a little bit too much of something that you can get every day in a store. So you have to be careful. And I ran up against something else. Some people have been taking things like colloidal silver. And colloidal silver was supposed to be, a few years ago, was supposed to be a cancer preventative. You didn't get cancer, or if you had cancer, it relieved the symptoms of something. And so they were taking it. And then on television I saw about a woman who took too much of it, and her face turned silver. Colloidal silver is a form of silver, of course. And so therefore her face turned silverish. It deposited itself on the skin of her face, and you can't take it off. It's permanent. For some reason it settles into the system and it's there permanent. And sometimes her face has a bluish cast because of it. Sometimes it's just very reflective, like silver would be. Silver is a very reflective metal. It's actually more reflective than gold. And so she has a silver face, which is permanent. Her mind isn't affected. She thinks well, she can talk well, but in the light you can see her face is glowing silver. It's being reflective to the light because it's deposited on the skin of the face, and it's a permanent thing. So you have to be careful. I can remember reading articles about it. I can remember if you took it, supposedly it would help you with cancer, or you would prevent you from getting cancer. People were giving it to their pets, you know, because it came in a liquid form, and they could add it to water and so forth. They could give it to their pets and so forth. And so, it's just dangerous to fool around with. If you turn out that you are anemic, don't start loading up on the iron, because there are various forms of anemia. And only one form is due to iron deficiency. Most forms of anemia are due to other things, not iron deficiency. And you can get too much iron in your system and you can get real sick. There was a health product a few years ago, and I don't even know if they have it or not, but you could take it. It had a lot of iron in it. And it would be a healthful thing. It was a drink or it was a pill, whatever it was. And even I started taking it. And people were saying they had so much energy and they felt so good. And this was the way to go, and you could be healthy. And then some people started getting sick. They were overdosing on iron because it was loaded with iron, much more than what you would normally take. And if you had a tendency to be iron deficiency, it might help you some, but most people aren't necessarily iron deficient. And so as a result of that, people got real, real sick. You can, if you take enough, be more or less dependent on anything. You can be dependent on cough syrup, although there is alcohol and some other addictive substances in cough syrup, so some people get addicted to that. I knew someone that was addicted to nasal spray. There is on record a person who was addicted to lettuce. Now, it's only a leaf, but some people really need to have their lettuce, and she had lettuce everywhere. I mean, she took it with her when she traveled. She took it with her to work. She had a drawer full of leaves of lettuce, and every so often she'd eat the lettuce and she'd feel better. I wouldn't be concerned about that. I don't know if you can overdose on lettuce, but what I'm trying to say is we have a tendency to become dependent on something that's going to help us. And one of the fears that people have, if they have anxiety, they fear that they're not going to get rid of the anxiety, or depression. They fear that they're going to have depression. And with that, they're afraid they're not going to get over it. And a second fear that goes along with that, I think, is the fear that you're going to have to go through your symptoms alone, and there's going to be nobody there to help you with them. Because we need to have other people to help us when we need to have help. We need to have other people help us. And we need to know that someone's going to be there for us when we need it. We get dependent on other people. Now, some people have dependent personality disorders, and they very easily become dependent on other people. But I think anyone will need to have some support system, and that's natural. We are created to be a social kind of organism. We aren't created to be loners. There's nothing wrong with being a loner, but everyone needs to, at some point, they need to have somebody around that can shepherd them through something if they're going to have difficulty with it. Someone that they can rely on to talk to, somebody who has the same kind of an illness as they have, so they can say, this is what's happening, is this normal, and is this something I can expect to go through, and how do you nurture yourself to get through it? If you have something that's really troubling, I think of women who are in menopause, and menopause, even though it's a natural state of the human being, some of the symptoms are really incredibly bad. And the fear is, if I don't have my estrogen, if I don't have my medications, if I don't have someone to talk me through this, I can't handle it. You know, some people have ended up in a mental hospital because their symptoms of lack of estrogen is just so severe that they can't handle it. Usually they just give you estrogen that you need, and it takes care of it, and so you feel a lot better. But of course you have to keep taking it, and the idea is to kind of damp down on it, so you take less and less as your body adjusts to not having the normal amount of estrogen in your system. This would be particularly true if you're a younger person and you have to have a hysterectomy for some kind of way or for some kind of reason. You know, you have polyps, you have cancer, they remove remove the ovary, and then you don't have the normal estrogen supply. Now, there are other organs that produce some, but not to the amount that you would get from the estrogenic substances in your system, from your ovaries, which is the main point, the main gland that produces it. And by the way, men go through menopause too. They have symptoms, but not like the women do. A man's symptoms are usually very gradual. They lose their hormones in a very gradual way, whereas women can lose their hormones all at once practically. Surgery will do it. They drop more quickly, and the loss of estrogen and progesterone happens faster in women, so their symptoms are a lot worse. Men usually lose some of their testosterone over a gradual period of time, so it takes a lot longer for them to go through the process, and so they don't usually have the symptoms because the body is adjusting to it as it's happening. But some men still go through it, and they have to have shots. Some men, not many, but some. So you can always become dependent on something, and we become dependent on people, but in a sense, I guess, that's all right. We need to be independent, but we need to realize that we are an interactive organism. The human being was made to interact with other people, should be able to interact with other people, and should be in such a social situation that if they have a problem, there's some place they can go, there's someone they can talk to, there's someone they can rely on to kind of talk them through it and help them. I think the fact that if we had that, there would probably be less need to have therapeutic help. But some people need that therapeutic help, and if you need it, you should take care of it. You should go. I know I was a counselor for many years. I had my own counseling center, and I was on staff with a couple of other counseling centers, and I was on board for emergency calls and all of that, because people do need help. And there's absolutely nothing wrong with needing help. If you need help, you need help. You're a human being. You're not perfect. You're going to run into situations that are going to be difficult for you. And there's nothing wrong with that. That's just a part of being a human being. But you have to remember that if you need help, you should get help. And there are lots of ways of getting help. So what I want to do is to go over these big box medications that we take for granted because they're not a prescription item, aspirin and things like that. Because if you do overdose, you can get yourself into real trouble. So I'll go through some of the normal ones, or some of the ones that we take normally, and show you what happens if you overdose. So I'm going to start in with acetaminophen. What has acetaminophen in it? Tylenol, Excedrin, Percocet, Sudafed. Those four are the main ones. If you get too much, what do you have? You can have liver failure, complete liver shutdown, and that's very serious, and you can die from it. What about the NSAIDs? NSAIDs are non-steroidal anti-inflammatory drugs such as aspirin, ibuprofen, and COX-2 inhibitors. And those are those are NSAIDs. And the risk is that it triples the risk for stroke, and it can give you heart attacks. Now, aspirin is given a lot because it also acts as a blood thinner. So if you've had a stroke, you can take aspirin. The doctor would prescribe it for you, and you can take sometimes what's called the baby aspirin, which is about 81 milligrams, or you can take the full strength, which is 325 milligrams, and you take so much per day. And it thins the blood so that you're not so likely to have a stroke. But at the same time, if you take too much, you can thin the blood out too much and get into trouble. So there is a risk, a slight risk of heart attack and stroke from these non-steroidal NSAIDs. Now, what about narcotics? And we're talking about hydrocodone, methadone, oxycodone. You can become very dependent upon them, and what happens if you get too much, you can have bone breaks and heart attacks from it. Watch your dosages of that. Now, of course, methadone is given to stop the side effects of not having enough of whatever drug you're taking, you know. So, but it is itself a narcotic. It is itself a drug that you can become dependent on. What about corticosteroids? This would be the cortisone injections. I don't know if you ever had a cortisone injection. It's one of the most painful things you could ever go through. I can remember playing instruments because I'm a musician, and I couldn't move this fourth finger very well. And it turned out that it was like a trigger finger. You could get it in a certain position. It didn't want to get out of that position. I could snap it and pop it back out. And so I went to a person, I was recommended to go to a doctor who specialized in this kind of thing. And they said, well, you have two problems. One, you're diabetic, and two, you're a musician. Musicians get this more often than other people, but a lot of people have it. And what they do is they inject cortisone in the place where it hurts the most. And that kind of takes care of it. It takes care of the symptoms, but it is kind of a shot that you don't go into lightly because, as they said to me, I knew it was going to hurt. I didn't know how much it was going to hurt. And I said, this will be painful, won't it? He says, oh, yes. He says, but once we're through with it, you will feel remarkably better in a short period of time. That's what they said. So they took and they wiggled my finger around, and they found out which was the most painful spot with a needle that looked like it was that long. And in it went. And I didn't cry out. I didn't say anything, but I can tell you, it is the worst shot I've ever had in my life. And I made a mental decision that I will never do it again unless it's absolutely necessary. And I haven't. And what they did, they got the needle in and they started wiggling it around. They had to get that right spot to get the cortisone in there. And then finally they took the needle out. And as I said, I never cried out or anything. But when they took it out, I looked at my hand to see if it was even still there. I thought maybe they'd cut off my finger or something. And it didn't immediately feel better, but within a fairly short period of time, it started feeling better. But that improvement lasted for quite a while because it got better by increments, you know, a little bit. I noticed a little bit every day. It was better and better and better. Now I'm still having a little trouble, but I'm babying it, and I haven't had another shot since. But those shots are effective, but you can only have them like 2 or 3 times a year because they tend to thin tissue, and you don't want your tissue, how thin can it be before you get into real trouble? But for people who are in a lot of pain, it does, even though it hurts a lot when they do it, it does actually help to cure the pain for sometimes quite a while, sometimes not so much. I think sometimes your body gets used to it, and then maybe it's not quite as effective. But that was my experience with the cortisone shot. The risk of taking a cortisone shot is the pain of it and the whitening of the skin in the injection site, which I did not notice at all. But I guess so you are limited like for 3 shots a year or something like that. And for people who have chronic problems with their joints, sometimes it is a help, but you have to put up with the problem of having the shots. Now, some people use magnets to stop pain because a magnet will slow the rate that the neuron will fire. The neuron fires impulses, and that's where you're getting your pain from. But most magnets are not strong enough to really be much of a help. Most magnets are too small. You have to have very, very strong magnets for it to work. Some people use copper, which is a metal, because the copper neutralizes free radicals. But you really would have to absorb a tremendous amount of copper in order to get the help that you need. So that might not be a good thing to do either. But I know that sometimes you can wear jewelry that has copper in it. You can get shoes that have copper in it. Supposedly that helps with pain if you have a problem with pain. And I haven't talked to anybody to see if it really works or not. I know somebody was selling items with copper in it, and they were trying to make a living selling these items. And you're supposed to feel a lot better when you wore the bracelets and all of that. They had copper in it. I didn't bother with it. I don't think it was that much of a help, but that's just my personal story. Maybe it was a help to some people. Now, hypnosis could give you deep relaxation and sometimes can help stop pain temporarily, but 20% of the people of the general public can't be hypnotized. It just doesn't work for them. So hypnosis, some people approve of it, some people don't approve of it, but it does help some people, and I'm not making a judgment either way. So those are the main ways that people have of helping themselves with pain. Now, I heard from 2 nurses, and I also heard it on television, a medical show, where if you combine 2 of these kinds of drugs, say Tylenol and some other kind of drug, that you can get the same effect as if you were taking hydrocodone or something like that. But I would need to check with a medical profession on that. It's nothing that I would advocate because I am a little concerned about mixing drugs together. But I know retired nurses and I know doctors have talked about it on television. There's a combination of 2 of these common drugs that you take together, and it gives you as much pain control as you would get from a hydrocodone. So it's something that if you want to check into it, you might want to check into it if you want to stay away from these stronger drugs. But as they say, I'm not even giving you the 2 names of the drugs together because I don't want to encourage something to do that unless you check with a doctor first and see if it's all right. So a lot of this relief is temporary, but this is what happens. If you take the drugs, you can get so that even though they're not addictive drugs, they are a problem. They can be a problem because if you don't watch the dosages, you can do damage to yourself. You can find yourself in all kinds of trouble, and so therefore you have to watch the dosages carefully. Now I'm going to stop it here because I don't have that much time left. I want to get into marijuana, but when I do that, I'm going to spend a whole segment on it, which will be the next time. And since we have so little time left, I don't want to start something and just get a little into it and then have to stop. So why don't we close it here, and then the next time I'll start a special segment on marijuana, which many people use, which is one of the reasons I want to get into it. So we'll close it here. Please join me next time.